Hello, my name is Jessica Collinsworth, and I'm a student at Brandman University pursuing a doctoral degree in the practice of nursing. I am here today to propose a plan that could benefit your facility by improving the quality of care and outcomes of patients affected by sepsis. During this presentation, I will first speak about the impact that sepsis has on our healthcare system and why improving sepsis identification is important, specifically within the long-term care setting. Second, I will outline my proposed project to help improve the quality of sepsis assessment in hopes to decrease episodes of severe sepsis in the already fragile nursing home population. Lastly, the logistics involved with the actual implementation of the project will be discussed. The roles and educational needs of the stakeholders that will act as key players within this project will also be discussed. Sepsis is often overlooked within the long-term care setting because it is a condition that is usually diagnosed and treated exclusively within acute care facilities. But sepsis is also extremely important to skilled nursing facilities, as many septic patients received in the ER come from nursing homes, and patients that are treated for sepsis sooner often have much better outcomes than those who experience a delay in acute care. According to the most recent data, sepsis is the most expensive reason for hospitalization and also the sixth most common admitting diagnosis in acute care facilities in the United States. With over a total of 1.6 million sepsis hospitalizations costing over $15 billion, the majority of which was paid for by Medicare. Medicare also happens to be a major payer source of skilled nursing care. 23.5% of skilled nursing patients are sent back to the hospital for treatment of sepsis within 30 days of being discharged from an acute care facility, and nearly a quarter of all sepsis hospitalizations are patients from skilled nursing facilities. One study even showed that nursing home patients are around 7 times more likely to develop sepsis than similar populations not living in nursing homes. The outcomes for septic patients are often grim. However, their chances for survival are greatly increased if treatment is initiated early, specifically within the first 6 hours that the symptoms of a systemic infection are present. The conclusion drawn from this evidence is that sepsis is a huge problem, especially for nursing home patients. In order to improve this healthcare disparity, I am proposing a plan to educate nurses on sepsis and help them accurately assess patients for its signs and symptoms using the Modified Systemic Inflammatory Syndrome, or SIRS, criteria, so that patients can be sent to the ER and treated sooner, possibly decreasing the need for lengthy and costly repeat hospitalizations, or possibly catching the infection early enough to be able to send the patient back to the skilled nursing facility with IV antibiotics, which in turn will save your facility, the patient, and the Medicare system large amounts of money and resources. The theoretical framework for the implementation of this project is explained in the ABCD systems model. The beginning of the map is shown in the current state, being no specific means of accurately identifying sepsis. The next step in the model is called the transitional state, wherein the project will be implemented. Letter A designates the goal of the project, which is to increase the identification of sepsis. This will be measured by the number of patients that are sent to the ER for sepsis evaluation. This plan may be revised or modified based on feedback and project outcomes, and the environment will continuously be accounted for by reinforcing education on the SIRS criteria and the benefits of early sepsis identification. The SIRS criteria is a simple tool that will allow the nurses to quickly assess patients and give them parameters for necessary notifications to healthcare providers. Many of these sepsis indicators are things that your nurses assess for every day. However, it will assist in bringing that information together to give them a clear picture of the signs and symptoms that are present in septic patients. In order to successfully implement and maintain this evidence-based change into practice, the Director of Nursing, the Director of Staff Development, and the nursing staff will all act as key players. The Director of Nursing will assist in the project by conducting audits to ensure the assessments are being completed accurately and to reinforce and re-educate nurses on sepsis and the SIRS criteria as needed, and will act as a support for the Director of Staff Development and the nursing staff during this transition. The Director of Staff Development's main role in this project will be to educate the nurses on how to use the SIRS criteria and why it is important. In addition to this, will also act as a support and will reinforce the education to ensure longevity and change maintenance. The nursing staff's role is the most pivotal, as they are the ones who will actually be changing the practice that will impact patients. Their role in this project will be to learn how to use the SIRS criteria, include it in their assessments, and also provide feedback as to how this project helps and how it can be improved. To successfully fulfill these roles, some learning will be necessary for each group. The Director of Nursing will be educated on the value of this change, how to successfully maintain the change over time, and how the benefits of the project will greatly outweigh the minimal costs associated with its implementation. The Director of Staff Development will be educated on how to use the SIRS criteria so that they will be able to teach the nurses how to use it also. The nurses will be given an overview of sepsis, its impact on healthcare, and how to utilize the SIRS criteria while documenting their patient assessments. The actual implementation of this project has been boiled down to 3 easy steps. The first step is to educate the nurses about sepsis and the SIRS criteria. The second step is to initiate the use of the SIRS criteria. And the third step is to evaluate the effect the change has on the number of patients sent to the ER for evaluation of possible or suspected sepsis. The nurses will be educated in an hour-long in-service that covers sepsis and the SIRS criteria. This education will be continued long after the in-services is over, as needed to support the nurses during this practice change. To implement the use of the SIRS criteria, laminated SIRS criteria will be provided to the nurses during the training and will also be provided at each nurse's station for reference during documentation. The final step in this project will be to analyze the results of the project by looking at the effect that this project has on the number of patients sent to the ER for evaluation of sepsis in comparison to before the project was started. Longevity of the project will be ensured by allowing for revision and adaptation depending upon the feedback of the nurses and the outcomes that are achieved following the initiation of this project. It is my hopes that you now have a good understanding of the theoretical foundation regarding why sepsis is important to skilled nursing care, the plan on how to address this problem, and what you, the stakeholders, can do to assist in ensuring that this project is successfully implemented and maintained over time. Together, we can make it a significant and evidence-based change in the often overlooked realm of long-term and skilled nursing care to improve patients' lives and decrease healthcare costs.